You're having pain radiating into your...
It's like on both pinkies. It goes down the side of the hand and then into the pinky. And then sometimes it'll like cramp, like right here.
Will your fingers come in like this? When
Just
it cramps?
It'll like, it's just this one. It's only the pinky. And it's not usually the day of. It's usually the day after. I could just be like typing on the computer or something real quick, and then all of a sudden just like cramp.
Okay. So when you're typing on the computer, and when else? After you lift.
That's usually the main two.
How about after you wake up? When you wake up in the morning?
I've never had any pain down my arm.
Just those two things.
Mm-hmm.
Okay.
It
but
is.
when you bench.
Yeah, definitely bench is when I start to feel it.
Okay.
Because when I go heavy bench, I can start to feel it in like the palms of my hands, just because I think it's the weight.
Well, see, it's been an eternity since I benched anything. But when I remember pushing the bar and having a lot of pressure here.
It's right, yeah.
Yeah. So I'm like, okay, I would have said like it was coming from your neck, or because we already did posture a little bit, and I'm like, well, you have a trigger point there. But the fact that it's on both sides, crushing it on.
Yeah, I try to do my best to like keep my my
need,
hands.
It's supposed to be at 15 degrees, the carpal tunnel here, but you might be pressing on this. Do you notice yourself leaning? Like with the mouse, do you understand?
Yeah. Now that you say that, because we don't get seats, we have to stand the whole time. So I catch myself like leaning against the.
That's what I'm saying. Something. Typing and benching don't go together. Okay, no. So there's only one thing that they have in common, and that's pressure here. Right, Linnea? You were having trouble editing, and you were hurting this part of your hand with the mouse. You were sitting there like this, click, and you're so, and then.
Yeah,
she heard
when it
that
started
part.
cramping up, and I was like, that's not right.
This part's red. Here.
Like right here? Yeah.
So that's why I'm like, pressure. I don't know. Let me look.
I was thinking it was coming from my forearm at one point, because sometimes I'll get...
Well, I was thinking maybe your neck. I was like, but the fact that it's on both sides. See, let's just start here. Let's have a seat here. We'll do some good old-fashioned wrist adjustment. It'll get some mobility in there. And let's do the elbow first. Let's start far away from it. Does that hurt when I do this? Nothing? Okay, there's the elbow. Radial head. Go down here. See if any of them are... Lean away from me. Okay, good. I know you like to pop these.
Yeah.
It's okay. Lean away again. There it is. All right. Now let me look back. Let me go back. I'm having a hard time getting
I can feel it, like, over here.
Yes, you know what I'm saying? This is stuck here. I was trying to get this radial head, this radius here to move. You don't have much flexibility here. So
I can feel it, like, pulling from, like, my bicep.
You need to do some yoga.
Like this more, before my...
Yeah, it's just, you're just pulling this. Your radius is kind of glued a little bit, up into your forearm. Sure, so you come in here. This is very painful. Sorry, but this is what you work on. You take some massage oil, you go through there. Okay, then you should get more range of motion. We can do that right now. It's just a very sensitive spot.
It's going to be fun.
Yeah. I don't know. You want me to do it?
Yeah,
no?
do it. No, 100%. Yeah, do it.
Oh, well. Ooh, that feels nice. That's a nice elbow. Like, ooh, that's a healthy elbow. Lean away. Those are the things that I pay attention to. He wants to go to Cairo school, so he'll be there one day, and you'll have an appreciation for this.
I'm just telling him, look at my elbow.
My elbow. I have a beautiful elbow on this side. Lean away from me. See how loose this side is, though? It's like perfectly fine. This side's a little stuck. Now, you still have that problem, though, over here. It's just you have overdeveloped forearms, and you gotta work on them. Right. Okay. And I know it's a weird location. You're like, why here and not over here? Because I want that.
Yeah.
Okay, so next we're going to go into here. This one's not nearly as bad. Just watch these fingers. Relax. Yeah. Do you understand?
Yeah.
It's all connected. So when you say, I feel a cramp, it's all up to here, okay? When somebody points here to pain, think distal or proximal.
Mm-hmm.
But the way you fix it is not going to be right there.
I thought it was coming from my forearm.
But you already kind of figured it.
Yeah.
And listen to your patient. When the patient says, you know what, I think it's coming from my forearm, check the forearm out and see what the heck's going on. Doesn't take anything to check it really quickly. Now, do the twisty one. Wiggle, wiggle, wiggle. I don't have enough strength. Yeah, I need you like, you're like, why am I subjecting myself to this torture?
It's not that bad.
Okay. Trying to be nice here. You could
Yeah,
just see your fingers cramp.
They're doing a little, dance.
That's what I'm saying. You gotta fix it. There you go. There. Now it's nice. Okay.
Connected.
It is. Take the blade. This is another level of tissue. I went really deep. Now let's just go on the surface. It'll catch the little problems at the surface. Like I knew you had one here. My hand couldn't get it. Relax your arm. I got you. I don't want you to hurt your shoulder. Or tighten your shoulder. There you go. Didn't really let go either was this one here.
It's supinating.
It's a supinating. It's a supinating muscle.
Is it?
It's responsible for supination. And that's.
Oh, that actually makes sense
Do you
because I do a
understand?
supinated grip for when my lateral raise. So usually, like a front lateral raise, you'd go like this. I use a supinated grip a little bit.
That will strengthen this.
Yeah.
Yes, and that might be why this is here. But your inability to supinate, understand, is cramping
That
this.
right there.
Yeah, a little bit more petechiae here. But yeah, you just go ahead now and take that arm and stretch it. There you go. Okay, when you feel those cramps, try doing that.
Okay.
Problem solving. Does anything happen in your hand when I do this?
No.
I'm not recreating the pain at all?
No. I feel it in my ear.
Okay.
That's weird.
That's normal.
Okay.
That's normal. Yeah, that's totally normal. There's nothing here. Can you tell?
Yeah. Like,
When you feel how like this is hollow?
And the other side is way tighter.
Yes, so again, right side more developed. Right side's got a big old knot, trigger point, covering the brachial plexus. Okay, so it's a process of elimination. In the way I work, I try to eliminate them all. Okay? There's also another one back here.
Oh yeah.
All right, that one really goes to the pinky. Do you feel that going down into your pinky at all?
On the right side. The left side's not that bad.
Not bad here?
No.
I mean, I'm pushing on it too.
Ooh.
Nothing?
Like, I'm feeling it now. I'm feeling it now.
Do you feel it into your pinky though?
No.
No, okay, that's a good sign. Diego just randomly walks by. You're like, I don't know.
You guys cut it out.
I don't know. I'm figuring things out. It's a process of elimination here.
Yeah.
There's a big chain from your neck all the way down to here. Any spot that we can get relief from will help you.
Yeah.
Does that make sense? Yeah. Okay. On your back, face up for me. How's my hair, Linnea? That's all I'm worried about. I'm just kidding. Cringe. Got a right atlas there. Ooh, all right. Let's get it. Okay. Oh, and then I get into it. I'm like, cringe. Oh, I'm sorry. Too much?
No, you're good.
This is going to be some work. You've got some muscle density here in your neck. Got some power.
Probably from wrestling.
Okay.
Got a lot of people pulling on the back of my head.
Well, no wonder you want to become a chiropractor.
Shit.
Jeez, but I will tell you, you can't fix yourself.
Yeah.
You can't. I mean, you can to a certain extent, but you're gonna have to find somebody else to adjust your neck. That's like the hardest part for me to adjust on myself. Like, in fact, I can't do it. That and the upper T1 ribs. I can't get them. I have to have somebody do that for me. And then there's that. There you go. Ooh. So you understand how this isn't really a massage.
Yeah.
It looks so relaxing. But when I might come in here and ooh, it eventually lets go. Eventually. And then it'll start feeling okay. Alright, chin back for me. This is just whew. I gotta concentrate on this one. Here we go. This has not been. I gotta even look down at you. Yep, there we go. Ooh, it's part of it. I got you. C2. Piece of cake. Not really. It was difficult for me there for a second. Right here. Perfect. I always get a little kick out of it. How are you doing? How are you doing?
I don't think I've ever had a chiropractor move my neck like that.
Oh.
It was like first time.
It's a powerful adjustment up here. Way up in the top of the neck where no chiropractor likes to go. No, I'm just kidding. They do. It's a little bit of a, when you first start, it's such a hard bone to move in the beginning that you shy away from it. You can. Some chiropractors can. I'm like, no, just be determined to move it. It'll move. Practice, 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 practice. This is nice. This feels good. The joints are supposed to go this way. Nope. I'm gonna leave it alone. It's. I think that I'm fiddling around with it a lot. You're gonna be a little sore tomorrow. I've taken your neck and made it putty. It's like there's no resistance left. It's
done.
It's done. It's done. That was a huge alignment there, okay? Let that relax. Let your brain reprogram itself. Let the cerebellum take over. And then we say, hey, you got these down here too. Go to the top part of the body, go to the bottom. They say above, down, inside out. A little bit. Nothing broken in the ankles, though?
No.
Well, now they might be. That was a loud crunch. Oh, my God. Oh, shit, toes back. Back. I got you.
Fly off the table.
Bend your knee. There you go. No, I don't. Spoke too soon. Hip. This side, I don't think it's gonna go. Hold, use those muscles. Bend your knee. You're tightening the leg though, it's okay. There it is, there it is. There, good, perfect. Okay, now, on your stomach. Yeah, here's this thing when we were checking your posture. Boy. This is 6, this is T6 here. 1, 2, 3. Right there. Would you say this is the worst one?
Yeah.
How about this one here? This one's really bugging me, but it might not be painful.
It's not as bad as that.
As these up here.
Yeah.
Yeah, these feel like really irritated. This one I gotta give it some direction. Are you ready?
Mm-hmm.
Deep breath in. Oh, yeah. Look at that. I don't know if I'm gonna get it. God. That was like at least 3. One shot. Very good. We got one more here though. Deep breath in and out. All right. Okay. At the top, deep breath in. Oh, yeah. Very good. Ooh, you all right?
Mm-hmm.
Ticklish?
Definitely more pain than ticklish.
Pain, okay. Pain is okay. I don't like the tickling. Then I back off. Okay, breathe. This thing is mean. You're doing good though. Do you understand? I have so much to cut through.
Yeah.
I can't play around with this thing. I'll be here all day. So
Do what you gotta do.
Okay, as long as you're okay with that, okay?
Yep.
I'll keep going. I've got all that to work through. This is why your adjustments aren't holding. It's just your muscles are in a spasm. And we never get, you're not stretching them. You're not stretching the front. It's okay, easy fix. It's an easy fix. You just get on the foam roller and place it right here. And I'm going to press. Great. I'll work with you. Here we go. Come on. Bring that down. Excellent. There you go. There we go. Big knot on the right-hand side here. You doing all right?
Mm-hmm.
Yeah.
I just got me sweating a little.
He's got a couple of ribs out here that I did not notice with the shirt on. You know, as the light hits it, you start to go, what is that? Why is there a lump over here? Look, I am going to nitpick you, though you have never been nitpicked before, okay? I'm like, nope, that shouldn't be here. In all honesty, you're fairly balanced. I'm really picky. See, it's not, well, no, right foot there. All right. Nope, no. Whole thing. Entire thing.
He said, no, that's all wrong. It's
the whole thing. It's gonna happen. Here we go. You all right?
Yeah.
You're doing fine. This right here, if you can learn how to do this, you'll change a lot of people's lives. It's a much neglected area. This is T1. I know you feel it.
No, first rib?
Your first rib, exactly. Remember that brachial plexus, the whole discussion with the thoracic outlet?
Yep.
This is the one that is at the core of the thoracic outlet. Everything is a hinge off of this. It's some sort of a branch. You fix this one, the rest of them come into place. As long as there's no like gross abnormalities or deformities, right? In general, you bring this rib down. You find that corner. It's going to be hard. You're going to have to teach somebody else to do it and say, okay, that doesn't feel right, and then do that on them, and they'll say, that's not right. You know what I mean? You have to, like, I have to go back and forth between my brothers and my dad in order to figure this one out. Come on now. Oh, shoot. There it is. Yeah, that's bad. Sorry, I tap and to distract you guys. Give you a break. I'll work with you, okay? This is I can tell this is not moving. It has no spring in it. Let's create some spring. Let's create some movement. Just from studying, maybe even typing at work. Mm-hmm. You're dragging your shoulders up towards your ears. We all do it. All of us. Here's T3. All right, I'm gonna give you a little break. All right. Oh my goodness gracious. I lied. I didn't fix this one. Oh, little scar there. I'm gonna go a little bit more deep, right on top of the rib head. You just busted some rib heads here. In the past, this is a little while ago.
Wouldn't be surprised.
I mean, yeah, it's just with all the wrestling and jiu-jitsu you do, it's bound to happen. I just don't, even though you don't have pain here, I don't want them to create pain somewhere else because these are stuck, right?
Yeah.
So then the compensation, something else will have to make up for that lack of motion. You understand?
Yeah.
This is preventative care, wellness care. Oh, feels great. Mm-hmm. For some reason, I'm not sure why, but this side isn't letting go like the right. It's almost there. I'm not saying it won't. It just needs right there. Ooh. The adjustment either fixed a lot of it, and this is what we're left with. All right. I remember that. And down in there. You're like, oh crap, this again. You're doing great though. Like, you're learning your whole body here. All right, good. Doing all right?
Yeah.
Okay. What is that, from like C7 down to maybe L3? So L3 was where they told you was injured?
Yeah. It was slightly herniated.
L3 here?
Yeah.
Oh.
I mean, it definitely feels a lot better from when I first got in the accident.
Okay. I mean, a lot of people, let's put it that way, a lot of people have herniations and they don't know it.
I just know with how much I push myself that I need to do this kind of stuff.
Yep. It's good that you're becoming a chiropractor. Lots and lots of water. Which you already do, don't you?
Yeah, I try and hit a gallon a day. I usually get about 3/4 of the way.
Amazing. How often do you have to pee then?
When I first started doing a gallon, it was like every 10 minutes. But you start to get used to it.
Ah.
So I probably go like 4 or 5 times a day.
Interesting. Very good. Not much here. Very good. Not too much scar tissue. I worry about this because this is where the QL attaches, okay, and it can influence this. But no, it feels really good. Ooh, that is firing all the way down into your low back. Amazing. And right along the border of your scapula, you have petechiae. sore over here at all?
Yeah, I worked out this morning.
Oh, you didn't tell me that. I should have known. I should have just known.
Yeah, tomorrow's my rest day.
Okay, 2 resting then tomorrow.
Oh, yeah.
It would have gone a little easier on you.
Oh, no, you're good.
Well, I guess if you work out as much as you do, maybe there's no avoiding it. Well, then heal tomorrow. Back to the neck, you're gonna tuck your chin. There we go. Well, we have patients that go to the medical doctors afterwards.
I'm like, what?
And they're like, do we need to have a talk? Yeah, they don't know what it is. And they try to explain what this is to them. The medical doctor's like, I don't think so. So I'm like, yeah, can you not schedule the MD the same day as the scraping, please? But people like to get all their appointments, out of the way. Yeah. Like, unless he knows what this is or has researched it, he's going to say it's a bunch of crap. Once you start researching it and understanding what it does and had it actually done to yourself, then you'll start knowing what it is. Because a lot of this stuff can't be explained by science. We know a couple things. We know that there's increased blood flow.
Mm-hmm.
We know that there's pockets of congestion that I felt that when I scrape them, you gain more mobility.
Mm-hmm.
And those pockets are usually the most blood-filled, and it comes to the surface. Now, in a piece of scar tissue, do you think blood travels very quickly or slowly?
It's going to be slow.
It's going to be slower. So is it going to build up a little bit of metabolic waste around the bend?
Yep.
Yeah. At least that's what I think. Now, are we going to suck this petechiae out of you and go test it in a lab? Okay.
I mean, for science.
Why not? All I know is that afterwards, what research has shown is that people have increased mobility, better range of motion. You're taking an edge and you're running it through scar tissue. You're combing it out. You're making it more pliable. Guys, usually that's the first thing they want to do after this is go work out and see what their gains are. I'm not telling you to do that, but like guys your age, that is what they would come to me, like in North Dakota, and like, oh my God, guys, you're gonna hurt yourselves. Can you at least give me 48 hours? Feels good. That's about all I'm gonna get you. Now there's a lot of redness right now on his back. That's just from abrasion. He's got oil on him, so it doesn't tear apart his skin. These little dots that come up, that's the petechiae. That's what you want to bring to the surface. Ow. Yeah, see, your ribs are no joke. And I'm on a rib right now. I think I did a pretty good job, though. Now, this is the bad side, so let's go to the bad side. Yeah. You need to get a cane. Those massage canes? Right here, you pierce this, and you bring it forward. This feels nice. Even though there's some scar tissue left, you gotta have it slowly broken down. Feels good. We're gonna do the pecs.
Okay.
This is a... How am I gonna get this? You're really developed in your pecs. Okay, apparently I don't have to work too hard.
No.
Okay.
I did it 2 a day yesterday in the chest.
Okay.
That's why.
All right.
I had 1 rep max yesterday, so it was a little extra tender.
All right. Very nice. This is.
I think I know where my shoulder pain's coming from.
I've got it now, Doc. Like, you can stop. Ooh.
Lovely.
See what you got. I don't think there's anything in here. Looks pretty clean. But you got to understand that here's the brachial plexus that drops here.
Mm-hmm.
So we relax this, 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 this. There's even the subscapularis muscle. That you don't feel increased pressure into this vein?
No.
Because look, you see where this vein goes all the way up into? Watch.
Mm-hmm.
Can you see it?
Oh yeah, I see it.
Okay. See how far up it goes? So as long as you're not feeling any pain, no.
No.
Okay, just look away from me so I don't hit you in the face with the boomerang. Oh, I just keep seeing this vein pop out. And it's all the way up
Promise
here
I'm okay.
too. You're all right? All
Yeah.
right, all right. I'm cutting through Florida here.
Someone's gotta do it.
I'm like, I'm not hurting you, right?
No.
You know, the veins are pliable. They can handle it. But you can see this one all the way to here. I can, as I push the blood through it. Woo!
Awesome. Sick.
You see that? Linnea's like, I'm gonna puke now. Whoa.
I've had people ask me if like I've been on steroids because of it, or like.
Yeah, you just don't have much body fat. There's no fat there, so it's just you see everything. At least that's how I interpret it.
Yeah, because like when if I flex my chest, you can see like my
Oh yeah.
like.
Until I get into here. We warm it up first. Alright, there you go. Alright, so what about now? You don't feel it right now?
No, I mean, like I felt it when you like really pushed in there, but I don't feel like any pain.
But you did feel some.
Yeah, like I could feel it in my like the palm of my hand.
How about out on the outside?
Not on the outside.
Alright, anything else?
No.
Oh, we have to adjust your SI joints. And roll and lean your head up. Oh. Very good. I'm gonna shut up now. Roll. Perfect. That's how I feel. That's how you feel like you feel at a party afterwards. How do you feel? Take a walk around the room.
Good.
Ready for a nap?
Yeah, definitely.
Yay! Feel good?
Yeah, I feel 100 times better.